All right. Everybody can hear me okay? Great. So I guess we've been asked to provide a bit of a summary of both of the sessions that just took place. I'm going to try my best to give a summary because the session, as you know, just ended about 30 seconds ago. But definitely a great, very thoughtful session. So, and I guess I should probably tell you the name of that session if you weren't here, but the session was focused on reconciling skill shortages and chronic underemployment of immigrants. And so we had 5 panelists and we talked about OLIP's economic integration strategy. We looked at skill shortages in certain industries, so particularly the construction industry. And then we heard a little bit about research and some of the programs and services available here to immigrants and, you know, programs around qualifications and whatnot. We covered a lot of ground. There were some great questions from the audience. You know, I certainly a very complex subject. We heard some questions around, you know, filling some of those sort of short-term employment needs versus long-term employment needs and the balance against that. We also really touched on the more human piece of the conversation. So not just focus on filling those jobs and those targets, but really looking at the people and setting expectations before people come and work in Canada. You know, it's a long process, especially with that qualification piece and getting those qualifications. And then, as I said, really that sort of human touch to that and looking at the cultural belonging, the social belonging, people's expectations, their job satisfaction. We talked a little bit about progress, talked about building resiliency, talked about people, you know, really being satisfied and having the services that they need. But I think, you know, the key message to me is this is, you know, it's not so much of a sprint, but it's a bit of a marathon. It's a process and it's going to take time, you know, to have people have jobs commensurate with their skills. And there's also a role for employers to play. And that role, I think, gets a little bit more complex as you have those small and medium-sized employers that maybe aren't as equipped to do that. But I would certainly say, you know, I'm optimistic. We heard from BOMA. There's lots of great programs out there that people can tap into. And I think the other key thing, and I know from being from the city of Ottawa, that what's important to us is really that partnership and that collaboration and everybody in the city working together. Thank you.
Hello, I'm Andrea. I moderated the session upstairs that was titled Services to Temporary Residents, Working in and Supporting and Researching in the Area of Refugee Newcomers. We had 3 presentations starting off around research and an overview of services for temporary residents, was followed by discussion around refugees in the context of a tired and tapped out healthcare system, focusing on access to healthcare, knowledge of options and navigation challenges. And then our 3rd presentation was really focused on the barriers that temporary residents face and the challenges that are presented to our settlement sector. And some of the highlights of our conversation were around challenges. I can't say that we were as optimistic in the temporary residents claimant conversation than probably the employment one. Access to information, access to financial supports, inaccessible access to healthcare, capacity issues in responding. We talked about barriers related, I've got a ton of notes here. We talked a lot about the barriers around knowledge, information, transportation, financial support, housing, of course, we can't leave out housing. And then we had some calls to action that were eloquently presented that I can't do as quite a good job, but around universal access, linguistically and culturally appropriate services, financial support, which is not consistent. We know that it's out there, but it's not consistent among the various statuses that temporary residents have. And how do we remove barriers of access to health care, which is essential to our communities in terms of prevention and access and prevention, sorry. One of the more Towards the end of our session, though, we started to talk about the effects of the work that we're doing with temporary residents on our staff and the capacity that our staff have and don't have in order to support all newcomers, because us in this sector and those who intersect with this sector actually can't say no when somebody walks through your doors. How do you refer on? How do you work in partnership? How do you work in collaboration? What is the stigma that's attached to the word temporary? The very first thing that I heard this morning was getting rid of temporariness. And I think that that is just so important. The vulnerability that temporary residents feel just by being called temporary. And, you know, a shout out to Anna, who I think has gone, who said that they're not welcome in they come to her, to the Y, and they say, I'm not welcome in my own country, and now I don't feel welcome in this country, and that's because of the word temporary. So it's not a happy thought to leave on, but it is food for thought. And as we are entering into a new call for proposals, which many of us will be investing a lot of time and energy in the upcoming year, this is something that we need to advocate for. There was a lot of conversation around advocating for change, for funding changes, for navigation changes. And I think I'll just leave it with that for everybody to consider and to make sure that you have that as a part of the conversations that you're having around your own tables when you're looking at where you're going to be going in the next 5 years. Thank you.
Big thank you to our moderators, Andrea Gardner and Sheila Doherty. Thank you.